Decreasing fertility rate possibly increased the incidence of Kawasaki disease in Japan. Kawasaki disease emerged in Japan in the 1960s. There were outbreaks of Kawasaki disease in 1979, 82, and 86. After these outbreaks, this illness increased continuously. We aim to identify the factors which underlie the emergence and the surge of Kawasaki disease in Japan. The annual incidence from all 47 prefectures of Japan was regressed against 7 climatic and socio-economic variables in this table. We employed spatial regression and time series regression analysis. In the multivariate spatial regression analysis, the total fertility rate remained as the significant negative determinant of the incidence of Kawasaki disease. In this figure, total fertility rate is colored from white to black in descending order. Meanwhile, the incidence of Kawasaki disease is colored reversely. These two images are very similar, indicating that total fertility rate affects the incidence of Kawasaki disease negatively. We applied a multivariate time series regression analysis to the incidence of Kawasaki disease, which was reported between 2000 and 2010. As a result, the total fertility rate remained the most significant negative contributor to the incidence of Kawasaki disease. Particularly, the total fertility rate, which was recorded 15 years prior to the incidence, exerted the strongest negative impact upon the incidence, as is shown in these figures. Therefore, the total fertility rate, which was recorded 15 years before the incidence, was incorporated into the time series regression equation. Below, panel A shows Japan's total fertility rate, which was recorded after the Second World War. This time series of Japan's total fertility rate was substituted into the time series regression equation. The broken line in panel B shows the incidence predicted as such. Of note, the emergence of Kawasaki disease in the 1960s was correctly predicted. This implies that Kawasaki disease emerged in the 1960s because of the dramatic fall in the total fertility rate in the post-war era of Japan. Interestingly, there is a protrusion on the predicted line at 1981. This protrusion was predicted by the sudden fall in total fertility rate in 1966. This suggests that the decline in the fertility in 1966 ignited the outbreak of Kawasaki disease. Total fertility rate is defined as the expected number of children born to a woman. Therefore, total fertility rate reflects the number of children in a family. Our analysis revealed that the total fertility rate is positively correlated with the force of infection of Kawasaki disease and those of other pediatric viral infectious diseases, as is shown in this figure. Consequently, the downturn in the fertility in the post-war period of Japan should have decreased the force of infection of pediatric infectious diseases as well as that of the etiological agent for Kawasaki disease. Paradoxically, this decrease in the force of infection increased the incidence of Kawasaki disease. We plan to submit a report aiming to explain the mechanism which links the decrease in the force of infection to the increase in the incidence of Kawasaki disease. The total fertility rate has been falling worldwide. This downward trend is most prominent in developing countries. Therefore, the force of infection most likely declines rapidly, especially in developing countries. The year 2020 saw a global pandemic of the new variant coronavirus. Hygienic habits such as face masks, hand washing, and social distancing became new norms everywhere in the world. This behavioral change will inevitably decrease the force of infection of almost all infectious agents of humans. As a consequence, this decline in the force of infection may ignite outbreaks of the conventional non-COVID-19 Kawasaki disease worldwide. We are grateful to the assistance by Yoshikazu Nakamura and Mayumi Yashiro of Chichi Medical University. Thank you very much.